Hey, I'm Gina. I'm a dental hygienist and a Burst ambassador, and you're watching Burst TV. There's so much information out there these days, it's almost overwhelming. Do a quick Google search on cavities or gum disease, and you'll find contradictions right away. So let's talk about some common dental myths and debunk them. Brushing your gums causes them to bleed. This statement is false. We have millions of bacteria in our mouths. Every day, bacteria that causes tooth decay, cavities, and gum disease tries to colonize our mouths. It builds on top of each other, and in every area of your teeth that doesn't get cleaned, that bacteria, which we call biofilm or plaque, continues to make stronger bonds to each other and stick to our teeth. Most of this bacteria actually builds up right at the junction of our teeth and our gums. So what happens when we miss that area where the teeth meet the gums? Our immune system sees it as a low-grade infection. The gums get puffy, red, and bleed easily, especially if we happen to brush that area where the bacteria has been building up. We call this initial infection gingivitis. So our gums will bleed if there's already an infection in our mouths and not because we brush the gums. Side note, if you continue to notice bleeding even after you've gotten in a good habit of brushing at the gum line and flossing every day, see your dentist. They can take a closer look and help get your gums healthy again. Okay, next myth. Babies suck calcium out of their mother's teeth, and that's why women get cavities during pregnancy. This is false. If there's a shortage of calcium, her bones, not her actual teeth, will provide the calcium her growing baby needs. However, problems with teeth during pregnancy can actually be caused by acid reflux or vomiting from morning sickness, which can lead to tooth decay. Pregnancy hormones can also affect the gums by affecting the body's response to bacteria around the gums, leading to gingivitis signs like puffy, red, bleeding gums. The best way to counteract this is by continuing to have good oral hygiene, gently brushing along the gum line with a soft bristle toothbrush, preferably sonic, and cleaning in between the teeth with floss, using a water flosser, or even using interdental brushes like proxy brushes or soft picks. Myth number 3, we don't need to brush babies' teeth or take them to the dentist for a checkup because they'll fall out anyway. Again, another false statement. Baby teeth will get cavities just like adult teeth, which can cause pain and problems with eating for them. Having to get a baby tooth pulled before it comes out naturally can cause problems with the adult teeth as well, because baby teeth hold space as the jaw grows to allow adult teeth to come into their correct position. Parents should make sure to brush with a brush that is small enough to reach all the baby teeth, and if your baby has a hard time with brushing, please don't get discouraged. You are doing a great job. You're doing your best. A few things though that might help with brushing is letting them brush first, get the feel of it, singing a special song while brushing, or even trying an electric toothbrush. One more thing about baby teeth that will keep them healthy: choosing the right snacks in between meals. Healthy snacks includes cheese, fruits, vegetables. Try and avoid things like crackers as they form a sticky paste on their teeth that stays on their teeth for a long time, feeds cavity-causing bacteria. Another no-no is juice in between meals. Instead, keep water only in their sippy cups. Myth number 4, all wisdom teeth need to be removed because they will move the rest of the teeth forward, cause crowding, and crooked teeth. False. Wisdom teeth cannot exert enough pressure to move the rest of the teeth. Studies have shown that people who don't have wisdom teeth can still experience crowding, and people who have wisdom teeth experience no crowding at all. These two are not actually related. Instead, some studies have shown that crowding can happen in the lower jaw as it grows and rotates during teens and early 20s. This can influence the direction of eruption of the teeth and their position in the jaw, ultimately leading to crowding. However, there are many other reasons why your dentist may recommend removal of your wisdom teeth still. A wisdom tooth could stop the eruption of an adjacent tooth, cause cavities on adjacent teeth, or even damage the roots of adjacent teeth. Number 5, getting a deep cleaning or scaling root planing will cause spaces in between the teeth. Okay, I hear this one all the time, and this statement is definitely, you guessed it, false. A deep cleaning or scaling or planing is performed by your dental hygienist when there has been a diagnosis of periodontal disease or gum disease. Your dental team evaluates a few things when deciding whether or not you need this type of treatment. When the pockets around the gums exceed the normal healthy readings, the gums are puffy, red, bleed easily, there's bacteria and calculus buildup below the gums, this procedure is recommended. Most often, all of these signs also accompany bone loss around the teeth. If no treatment is done, that bacteria below the gums will contribute to bone loss, eventually loose teeth. So when your dental hygienist cleans the root surface of the teeth that have been affected by bacteria, the gums will generally heal and tighten up, in some cases leading to slightly more space than before. But this is not caused by the procedure itself. It's caused by the bone loss that was already there. Scaling and root planing actually halts the disease process and slows down the process of bone loss. So, did you know about all of these dental myths? Are there more that you want us to post about? Let us know. As always, thank you for watching, and leave a comment below if you'd like to learn more. If you enjoyed this segment, please subscribe, comment, and like this video.